Okay. Now we got to wait for it to pop up on here on YouTube. We should be live already.
It says, let's see.
Yep. I got the notification. So there we go. All right. So this will kind of give everyone a chance to join. Okay. Is yours popping up? Yours pop up?
I don't see it, but that's okay. I'm sure
There it
there's other
is.
people.
All right. Sarah's in the chat. Joyce is in the chat.
Hi, guys.
Yeah. Hey. Kaylin. Okay. We're going to go ahead and jump in then since everyone got the notification and they are joining. So with me is my friend Holly Robinson. Hello, Holly.
Hi.
We didn't really chat much before. We've been chatting in text the last couple of days, but that's it. But I wanted to have her on because she did a post, I don't know, a week ago or something, and there was a lot of feedback on the post. And this has been something that I've been meaning to do for a while, but I don't feel the most qualified because I'm not in the health. I have my own opinions, obviously, but I don't work in the health profession. You know, I can do all my own research, but I've never been to school for any of this stuff. So we started talking about this and we'll get into what the post was about in just a second. But first of all, Holly, so let me do my introduction. So I was just going to say, as moms, we want to know the best route of care for our children, obviously. As Christians, we want to be ethical when it comes to different jabs. And we're going to be talking in code a little bit today and different things that might be derived from fetal tissues. Sometimes it's hard to know who to believe and where to go for advice. While I have my own opinions about the subject, I'm one who strives for balance in my life in every area, even in this area. I would not consider myself crunchy. Some might say, because I have chickens and I drink raw milk and I don't do jabs, that I am crunchy, but I don't consider myself crunchy. I do use some natural methods at times because I'm also wanting to avoid over medication with antibiotics, which I'm sure we'll touch on. That being said, I won't experiment on my kids with natural things if it's something that they need antibiotics for. So go ahead and introduce yourself. Tell us a little bit about your family. And, if you wouldn't mind, can you share a little bit about why I invited you on today?
Sure. Okay. So I'm Holly Robinson. Some of you might know me, but for those of you who don't, I am married to Jason Robinson, and he's the pastor of Mountain Baptist Church. We have 5 kids. Their ages range from Clara will be 9 in about a month, down to Samuel, and he's 1. So Jason and I have been married for 10 years now. And before we got married, I went to pharmacy school and then did several years of additional training outside of pharmacy school, specialized in critical care medicine, which is basically like the emergency room and the intensive care unit. Since we've been married, well, I will say I spend most of my time at home. So I am a pharmacist, but the majority of the time I'm at home with my kids. I homeschool my kids. So this year we'll have 3 kids that are going to be in school. But I also am a pharmacist. So I go in to work a couple days a month. And I work overnight shift at the hospital. I work at 2 different hospitals. One's a children's hospital and the other is an adult hospital. So I can cover pretty much any realm of patients. From sometimes I work in the emergency department. Sometimes I work with just like regular floor medicine patients. Sometimes I work in the ICU, and sometimes I work at the children's hospital. So I see from birth until 100 years old. I mean, any realm of age. That gives me a very unique perspective. And we can touch on this later on, probably through the conversation. But because I see the worst of the worst happening, I don't want to say it taints my perspective, but it just gives me a different perspective than if I weren't in the hospital seeing those things. So something that I see that might be more rare, it sticks with me because I see it firsthand, and I see sickness firsthand all the time. So I think that gives me just a little different perspective and viewpoint on things, and definitely affects how I make decisions, not just for myself, but also for my kids, and also when I'm giving recommendations or giving advice to other people that plays into it.
No,
So,
I completely agree with that because it is our life experiences that shape our opinions and beliefs, correct?
yeah.
And I hold certain beliefs and opinions about medicine, sometimes a conventional medicine, sometimes non-conventional medicine based off things that my own family members have gone through, things that my closest friends who maybe had cancer have gone through. You know, that's what shapes our opinions and beliefs. So that's why I wanted to have you on because you do have a unique perspective. And I mean, I know you, I would consider pretty good, pretty well. And I know I have always felt like you have a good balance when it comes to using conventional medicine versus non-conventional. So that's why I wanted to have you on today because it's all about finding that right balance, you know, not
Yeah.
being too far this way or too far that way, which we'll talk about. But
So
I
do you want
don't
to get into
know.
the post or?
Yeah.
Okay.
Do we want to get into the story of why you were on? I don't know how much you're comfortable with sharing or how much you're able to share about that
Yeah.
story, but this is kind of what was the springboard for tonight.
Yeah. So I'll give, obviously there are, I can't give a lot of details. I can't give a lot of
Right.
specifics, but I can
Right.
kind of in general terms share the experience, just briefly. So basically I was working at the Children's Hospital. I was working overnight and we had a little baby that came in. Well, he was born at the hospital and he had severe anemia and was bleeding. And basically, he had to be hooked up to life support. He had to be hooked up to a breathing tube. Um, and essentially, the baby ended up not surviving because of the severe bleeding. But during that process, it was determined that the reason that he had severe anemia was due to his mother's antibodies attacking his red blood cells while she was pregnant. So this was her second pregnancy, and during her first pregnancy, she was exposed to positive Rh positive blood type. She was Rh negative. She developed antibodies, so her first pregnancy was not affected. She went on to get pregnant. Her second baby, so the little boy, had positive blood, and her antibodies crossed the placenta, attacked his red blood cells. That's why he became severely anemic and why he was bleeding. So she did not get Rhogam after her first pregnancy, and her body developed the antibodies, and that led to what happened to the little baby, which was severe anemia, bleeding, and he ended up passing away. So I
That is so
posted
sad.
about that. So I see a lot of misconceptions surrounding this topic, and I really debated whether or not to say anything, but I just felt like, I don't know, maybe this mother didn't have the information. I didn't speak to her personally about her decision, regarding this, and it wasn't really talked about at all. So I don't know specifically why she didn't receive it. I don't know what her thought process was. Maybe she had all the information and just chose to do a risk versus benefit and decided the risk wasn't as great and decided the benefit wasn't worth it. Which, if that's, everybody has the right to their opinion. I just think it's important that everybody has true information and has, doesn't make a decision based on misinformation. And so that's kind of why I wanted to share it, was because I do feel like there's a lot of misinformation surrounding this topic. And it's just really unfortunate that people can get led down the wrong path and make a very vital decision based on information that may not be completely accurate. So that was kind of the reason behind why I shared it. And I also feel like this side of things, so the medical side, where these tragedies do happen, isn't shared as often as people saying everything was fine.
Right. Yes, I agree. And I'm very interested in this topic because I want you to explain a little bit of the science behind it. My daughter,
Okay.
Abigail, even though my husband and I, this is really odd, but even though my husband and I are both A positive with our blood type,
Mhm.
we have several children that have different blood types than us.
Yep.
Abigail is one. She has A negative. So if
Hmm.
she has A negative blood, if she had a baby with a positive blood type, is that when she would need the Rhogam shot for the next pregnancy?
Yeah.
Okay.
So blood typing is we try to make it simple with when we describe blood typing. So there's two different things with blood. There's A, B, and O.
Hmm.
And then there's whether or not you are Rh positive or Rh negative. So the presence of the Rh, which would make it positive, it's not as simple as like just one protein. So I'll describe it in a way that it's simple as if there's one protein because it just makes it a lot easier to describe. But the science behind it is a lot deeper than what I'm going to go into.
Right.
Um,
You have to do it for us plebeians here who have never been to school. So,
so um, so if you look up Rhogam, it's called RHD immune globulin. So
okay.
the D is kind of what we most commonly test for when we're testing for blood type. So you're either RHD negative or RHD positive. So you either have the protein or you don't. So when it comes to blood type, you can be A positive, A negative. You can be AB positive, AB negative, B positive, B negative, or O positive, O negative.
Mm-hmm.
Um, being negative is a recessive gene, whereas being positive is a dominant gene. So if you are positive, you could be a carrier of the negative gene. So you could have, for example, it would be you would have A positive, A negative, but you would display A positive because that's the dominant gene.
Okay. Mm-hmm.
You can pass on either the positive gene or you can pass on the negative gene to your kids. So you could be A positive, or you could be A positive, A negative,
Oh.
and you can pass down the positive or you could pass down the negative. So if
I
you and your
always wondered how
husband,
that worked.
you and your
Yeah.
husband would both have to be positive, negative to pass down
Okay.
a negative, and you would both pass down the
Hmm.
negative gene to your kid. If your kid is negative, then they don't pass down, they can only pass down a negative.
Okay. I also have an O negative. So I have an A negative and an O negative, and then the rest are A positive.
So that would
Very-
mean you are probably AO blood type, positive, negative. If that
Okay.
makes sense. So
Because my mom was O. Right. My
you
mom
can
had O
pass
blood
down
type.
either an A or an O, and you can pass
Hmm.
down either a positive or a negative.
Oh, that's where that all
So
came from.
that's
I've
how
always
your kids
wondered how
would
in the
have,
world.
yeah.
Yeah. Okay. That makes
So
sense.
now where this comes in and like, so so the science behind it is you can either be positive or you can be negative blood type.
Mm.
If you are positive, then you can be exposed to negative blood type and there won't be any issues.
Okay.
If you are negative, though, and you're exposed to positive blood type, that is when you can become what's called alloimmunized, and your body will produce antibodies to that foreign protein. So think of the positive would be foreign to somebody who's negative.
Okay. Mm-hmm.
Um, so if you and your husband are both negative, then theoretically you would only be able to have negative blood type children.
Mm-hmm. Right.
You might hear people, and this is where the science gets a little bit tricky, and I won't go too deep into it, but you might hear people say, okay, that there could be errors in the test, which is true. And there's also a possibility that you have a different protein than the D protein. So the D protein is what they do the testing on for blood typing that would show up as negative. But there's other proteins that can be positive. They don't test for those because typically they don't cause problems, but it is a possibility that they do. So you could be negative in the D protein and positive in some of the other proteins and pass down the positive protein to your kids. Anyway, so we'll just focus on D though, because that's typically what's tested for. But you hear that argument and you might hear people say that, which is true, that your blood type might show up as negative, but you're really positive. And it would be because you carry a different protein.
Okay. That's interesting. So then what is in the Rhogam? And why is there controversy surrounding it amongst religious people? I consider religious people Jehovah's Witnesses, for one, because they are against blood transfusions of any kind. And then even amongst IFB, which I am IFB and I am not against blood transfusions. I am all for them if they will save a life. I'm not against that at all. So, but some religions are.
So Rhogam is actually classified as a blood product, not a medication. So it 9 times out of 10 does not come from the pharmacy department. Depends on what hospital you go to. Some hospitals, the pharmacies do carry blood products, and some hospitals, blood products are only carried in the blood bank. So where I've worked, all hospitals I've ever worked at, Rhogam actually comes from the blood bank. So it's considered a blood product. It's not really at all considered a medication, but it is derived from donated plasma. And essentially it, basically what Rhogam does is it causes your body not to produce antibodies against the positive protein. So if you're negative, they give you Rhogam, or you might hear Winrow is another name because there's a few different, I guess, brands you could call it. So they give you that, and it only works for a few weeks, and then the half-life is very short. So it's only in your system for a few weeks, and then it's out of your system completely. So it works for a few weeks to prevent you from producing antibodies.
Okay.
Which is why doctors will recommend that you get it in your 3rd trimester, and then again after the baby is born. So a lot of people have that question. Why is it recommended in the 3rd trimester and also recommended after the baby's born? It's because it has a short half-life, and it's a blood product, and it doesn't stay in your system for long term. And that's also why you would need to get it with every exposure or every pregnancy. So without going too deep, essentially that's what it does. So it's derived from a blood product, from plasma, donated plasma, and it prevents your body from producing antibodies to the Rh positive protein.
How long has this been out? Do you know?
I want to say like the 50s or 60s.
Yes, that's about
off the cuff. I don't quote me on that. I could be off, but I want to say 50s or 60s is when it all
you're probably about right. I don't think
it.
Okay, so my husband's grandma, she was Rh negative, and they only had 2 kids because I'm pretty sure at the time they didn't have Rhogam or something, and so she knew that with each subsequent pregnancy, she took the chance of miscarriage or baby dying after birth. And
I'm thinking I'm thinking it was the 60s. And maybe in the 50s is when this issue was being like reported and more identified, and then it was developed in the 60s. I think. Again, don't quote me on that, but I'm thinking it was developed in the 60s.
No, that's about the right timeline because I'm pretty sure it wasn't that out when she was having babies, and she would have had her babies. My mother-in-law's in her mid-60s, so yeah, so it would have been. That's about the right timeline. But why is there? This is fascinating to me because I've heard of Rhogam. I never had a problem personally with it. I didn't know there was controversy surrounding it. Honestly, actually, when I was typing some stuff in about this on Facebook, though, these groups popped up. And it was like Rhogam, the truth behind this evil drug or something like that. You know, some of these like support groups. And I'm like, wow, I did not even know this was controversial.
Yeah. So there's a lot of controversy surrounding it. So I'll hit on some of the major points of the controversy, and then we can go into any of them if you want to. So I was going to pull something up before I forget. I had a picture of something that I don't want to forget to touch on it. So let me pull that up. But some of the controversy, so Rhogam is derived from donated plasma, so it is a blood product.
Correct.
That during that process, when you donate blood or when anybody donates plasma or blood, there's a very strict screening criteria that goes into it. So they're tested for a whole slew of different bloodborne pathogens. They're tested for lots of different viruses and diseases. So if they pass that and they do donate plasma and blood, the blood is then put through, or the plasma is put through a machine basically, but it strips the blood or the plasma of any potential viruses. So if somebody slips through the cracks and they test negative for one of these long list of potential pathogens that could be in their blood or plasma that could be potentially transmitted to somebody through blood donation, it's then put through a process that will strip the viruses from the blood. So if it makes it through and they are actually positive, then the blood is cleansed of all of that. So the chances of passing on any type of bloodborne pathogen, whether that's a virus or most of them are viruses, but that they test for. But say something, a toxin or a bacteria or a virus passes through this testing, it would then get cleansed out through the process. I don't want to go into a lot of detail, but basically they clean the blood.
Right.
So it's kind of like a dual process to ensure that nobody is getting HIV or hepatitis or whatever. There's a long list that they test for, and then they also run it through a process that would strip out any of those potential viruses that might be there. So that's one of the things people are afraid of. Another thing, a lot of religious groups are concerned about receiving blood products from somebody else. If that is their stance and, they really are against blood products, then I could see why they would be against Rhogam, because it is derived from a blood product. I mean, essentially it is a blood product. So, a lot of people will, I don't want to say the V word, but they'll say that Rhogam falls into that category, but it's actually the complete opposite. So, shots will cause you to produce antibodies, and Rhogam prevents you from producing antibodies.
Right.
And Rhogam is produced from a blood product, which shots, the V word, those are not. They're completely different classes. They're not even in the same realm of medicine whatsoever. I mean, they're both injections. So, but there's hundreds of thousands of things that are injections, and they're not the same.
Insulin injection too, but
so that is one of the things, well, two of the reasons that people are concerned. Another thing that is commonly brought up as a concern is side effects. And there's definitely potential side effects from Rhogam. So the most concerning, I would say, would be an allergic reaction. And that's definitely possible. Anytime you get any type of blood product or any product that's derived from blood products, there's a chance of an allergic reaction. If allergic reaction does happen, usually it's a more mild reaction or an infusion type reaction as opposed to anaphylaxis. But anaphylaxis is definitely a risk that could come with it, although it's extremely rare. I would say it's more common with blood products than with any other medication, just because it's of the nature of what it is. It's a blood product. So there's definitely a higher chance of having a reaction. But with that higher chance, anaphylaxis is very, very, very small. But it's definitely a risk. So people that are concerned about that, I'm not going to downplay it and say it doesn't exist, because as with any medication, there's side effects. And that's definitely one of them. Another thing that comes up frequently is that, and I think we're going to touch on this later, but opting not to interfere with a natural process. So a lot of women, and this isn't just I would say it's definitely something that we see among like religious groups, but it's also something that's very common among like crunchy mom groups.
Right.
I would say
Mm-hmm.
that the birthing process is a natural process and we shouldn't interfere with it in any way. God made our bodies to birth babies. And if this was not supposed to happen, then he would have made it so it didn't happen. And so we should just kind of let things happen naturally as they do. So that is definitely another argument that I have seen in like crunchy mom groups and in like religious groups. I've seen that as well. And then the last one that I don't want to say last, but another one that I see commonly is that the risk of this happening, so alloimmunization happening, is very low, which actually it's 1 in 4. So 1 in 4 mothers who have negative blood type that are exposed to their child's positive blood type will go on to become sensitized and develop alloimmunization. So 24% or 25%, I would say it ranges from 20 to 25% is a high percentage.
Yeah, that's very high.
Mm-hmm. So a lot of people say it's rare, but it's really not. So I think that's a common misconception. I feel like people just downplay or don't realize how high the chances are of it happening, and also downplay the risks of future pregnancies and what could happen in future pregnancies if it does happen. I feel like there's just not a lot of information shared, and I would place that blame on doctors. I think that a lot of times they just say, okay, you're going to get Rhogam, and they don't even spend the time or take the time to sit down and explain why it's important. And then when they do try to explain why it's important, a lot of people say, okay, they're just using fear mongering. They're just trying to fear me or guilt me into it. When in reality, they're probably just very passionate about it. They've seen the results of sensitization, alloimmunization, and know that it can be very, very detrimental, and are just trying to share why it's important. It might not come across as empathetic. It might not come across as being, they might not be doing it in the right way, but I really do feel like they're not just trying to fear monger you, and they're not just trying to like be controlling. And I can tell you that they don't get paid for giving Rhogam. That's another thing. Like, oh, this is just like a big money-making scheme. Like Rhogam is a blood product, and doctors aren't getting paid for giving blood products.
Right.
So that's another thing. They feel like it's just like a big money scam that doctors are just using in it for the money. They're just using fear mongering tactics. And I don't necessarily, I would say doctors a lot of times don't come across the right way and don't present the information the right way. But I think genuinely most of them do care, and they're recommending it because they feel like it's the right thing, not because they want to harm you or harm your baby or get money.
Yeah, exactly. No, I'm very curious, but what do you say to the mom who left the comment where she didn't know much about it? Not much was presented to her, and she didn't get the Rhogam. And now she runs the risk of this happening to future pregnancies. So she's scared. Should I get pregnant again? What do I do? Because that's the thing that's crazy to me. So like if you don't get it and you do develop those antibiotics, you can't ever fix that. It's just done.
Yeah. So if you well, okay, so I want to go back to the whole developing antibodies part.
Yeah.
So 1 in 4 to 1 in 5 mothers who have blood mixing will go on to develop antibodies. The degree of the immune response, so how many antibodies the mother produces, varies from person to person. So some people can have a very strong immune response and develop a lot of antibodies, and other people might just have a low immune response and develop a few antibodies. And there's no good predictor as to who's going to develop a lot and have a really strong immune response and who's going to develop a few and have a very small immune response. So there's no predictor about that. It's just how your body reacts.
Right.
One predictor might be how much blood mixing occurred, but besides that, there's really no way to predict how your body's going to respond and how significant the immune response will be. So a mother who has a really high immune response and produces a lot of antibodies would have a greater risk to her future pregnancies, potentially, if the babies had positive blood type, compared to the mother that had a lower immune response. And her risk to future pregnancies, if her baby had positive blood type, would be a little bit lower. Now, antibodies will cross the placenta. So even the mother that had a low immune response, those antibodies will still cross. The outcome for the baby might not be as severe.
Okay.
So the story I told where the baby had severe anemia and was bleeding out, that is an extreme case. A lot of babies, I don't want to say a lot, some babies may not have as severe of a case. They might just have significant anemia and not bleeding. They might have anemia and require monitoring. Some might require blood transfusions. Some might have severe bleeding.
Okay.
Others, they might.
Can you see the group chat?
Oh, no, I can. Let me pull it up.
Because, Sarah said that she said this happened to her sister-in-law, and she's had very complicated pregnancies, and the baby had to be given transfusions multiple times.
Yeah. Okay, back to the mother who didn't get Rhogam,
right,
and then is concerned about future pregnancies. So they will test you to see if you're sensitized. So if you are pregnant and you say, I didn't get Rhogam, they can test you for antibodies. So there's definitely testing for that. And for mothers who don't want to receive Rhogam during pregnancy, a lot of OBs will recommend getting serial testing during pregnancy to make sure that there's no mixing during your pregnancy and that your body's not developing antibodies. Okay. So you can get tested if you're worried about that, worried about getting pregnant. You can get tested to see if you even were sensitized, because there's a chance that you weren't. Your baby may have had negative blood type, or if your baby had positive blood type, there's a 3 in 4 chance that you didn't get sensitized. So it's definitely possible that you didn't, or that your antibodies will be very low. So if you are to get pregnant with sensitization and antibody production, you can go on to have pregnancies. You would be considered high risk for sure. Most likely you would have to deliver early, and they would be testing your antibodies and be monitoring the baby very closely throughout pregnancy, just to make sure there's no significant outcomes for the baby. But a lot of these babies are either born early, which actually that's what happened to that little boy. So his mother came in with decreased fetal movement, and she was like 34 weeks along. And they had already known kind of her situation ahead of time. So the reason that he had decreased movement was because of the bleeding. So so a lot of these babies will end up passing in the womb and go on to have a stillbirth from like internal bleeding, or they'll be born, they might have, if they don't have lung bleeding, another very, very common area where they have bleeding is in their brain. So brain bleeds are one of the more common outcomes if there's going to be bleeding. But so for the mother, I would say get tested, because you can see if you developed antibodies, and if you didn't, then you don't have to worry about it. You can go on and have a very normal pregnancy.
Right. Do we find out our blood type when we go to the doctor?
Yeah.
And what about the women that are do midwives draw blood and find, like for home births? Do they find out?
So that's definitely going to be very midwife specific.
Yeah.
It would be whatever tests the midwife would order, but it's very routine for like the first time you go to an OB visit and they draw blood and check all your labs. One of the things they check is your blood type.
Okay. Mm-hmm. I can't even remember. I've had 8 kids and I just have known I was A positive forever. So that's something that happened a long time ago. All right. So that is definitely a good introduction with Rhogam. And I know we have so much on here. I don't even know. We have a 3-hour show tonight.
That was like 40 minutes.
What do you feel? How do you feel about blood transfusions? And is there, okay, so my opinion very quickly is it's kind of creepy to me getting someone else's blood and injected in my body. I understand that life is in the blood, all that. But if it comes to saving my life where I can do more for the Lord on this earth rather than going home at this age, I'm going to opt for the blood transfusion. When it comes to my children, same thing. If we truly, I'm a Baptist, I believe life is very important. And I believe that taking a life is horrible and life is one of the most important things on the planet, right? So for me to keep that life going is obviously of the most importance. So I don't see anything ethically wrong with blood transfusions, but what are your thoughts when it comes to that?
Yeah, I agree. I don't have any ethical or moral or religious. I don't see anything in the Bible against blood transfusions. I would personally get a blood transfusion and would have my children get them if they needed it.
Yeah.
Blood transfusions aren't derived from like fetal stem cells. They're not like people aren't dying to donate blood.
Exactly.
It's all from live donors. So I don't feel like there's anything immoral from it or anything unethical with it. That's my personal view though.
Yeah, exactly. I told the ladies I would hit on this on the jabs today because they were asking. I feel like this is one area where I would encourage everyone to not go off just one specific person, whether that's a preacher, whether that's, a scientist, whether that's a professor at a college. Do your own research when it comes to this stuff, even if it comes to just reading the inserts. That's what I did. When I first started researching this, I literally, when I was taking my babies to well baby checks and they were pushing the jabs, I asked for all the inserts of the jabs that they would be taking, and they gave them to me. My doctor gave them to me. So from there, I started my own research into it. But I don't know if you even want to go into how you do things with your kids, but how do you approach as a Christian? How do you approach this subject? I guess I'll just leave it at that.
So this specific subject is it's very like we all know it's very controversial.
Yes.
And it's not black and white. It's very deep. There's a lot that goes into it, not just and I don't want to like get my tinfoil hat on here, but there's like a whole rabbit trail to go down from that standpoint. But just from like a scientific standpoint, how things are developed, not every jab is the same. They're not all developed the same. They're not the diseases that they say that they're preventing are not all the same. The risks that come with the diseases they're preventing are not the same. And so I think that it's important to go into each and every one of them individually and look at the science behind each one individually, and also look at the diseases themselves individually and not just do it as a whole. They're not all the same. The science behind them is not all the same. The development of them is not all the same. It's just, that's how I would go about it. Each individual one, each individual disease. And you're going to have to make your decision based on your own risk versus benefit analysis, your own standards when it comes to how they're developed, what you believe is moral and immoral, and do what you feel is right for your family, not because anybody else is telling you that, not because your preacher is telling you that, not because your country moms group's telling you that. You need to do the research yourself. and know that they're not all the same.
Mm-hmm.
Because you don't want to make a decision, like I said at the beginning, based on misinformation, or generalization. It's not black and white.
No, I completely agree.
That's how I approach it. That's how we approach it
Yep.
for our family.
There have been times, pretty much since Lana, who is now 10, we have pretty much avoided all of them. But with Lana, we have in the past gotten a tetanus because there was a situation where she needed a tetanus shot. So we got her the tetanus shot as a preventative. Some people might be like, you should have just trusted God and irrigated the wound. It would have been fine. But we chose not to take that risk. So there have been, when I first started looking into it, I picked some and I did not choose other ones. I pick and chose what I was getting for my children. There are also ones that you can get from an ethical standpoint if you do not like that some are derived from fetal tissue. They do have other brands that are derived from non-fetal tissue. That I believe it's monkey. They're monkey. Well, then maybe you're like, well, then I don't want to inject whatever is derived from monkey. Well, whatever, that's up to you. But I'm just saying there are ways around if you still want to prevent the disease that they're promoting or preventing or whatever. There are other ways around it if you have ethical concerns about it. But I like what you said. I do believe it is up to each individual family. And I always say this to the moms watching too. Your preacher is not responsible for the care of your children. You are. He's not when even when it comes to like natural family planning or any of these other things, he's not the one footing the bill for raising that children. You have to figure that out. You have to figure out how you're going to provide. Your husband has to figure out how he's going to provide. So thus that is such a personal decision. It is up to each individual family on whether or not they're going to do natural family planning, whether or not they're going to do the jab or any of the jabs, whether or not, that's up to each individual family. So I would highly encourage you start researching. And I like what you said too. You have to even be careful about just believing everything with every group you're in. You know, you have to.
So this is a very very hot topic, but it's also a very, very deep topic. And I'm a pharmacist and a lot of people come to me for advice. And I don't like to give like generalized medical advice to people. Because one, I don't want to be morally responsible if you took my advice and something bad happened. Now, if I'm like actually providing care for you and I know your entire detailed medical history, I'll give advice. But I'm not gonna like come on here and give like generalized medical advice. I would say I'm giving generalized medical education. But not like advice that you should just run with what you heard on a 60-minute segment and think that can necessarily apply to you, because I don't know all of your detailed health information and your family history and all that. But I will say, when it comes to like all of these diseases and different things that the jabs are preventing, it's really hard. I think it's really hard to get a good idea of the risks and the prevalence of the diseases, because whether we want to believe the efficacy of them, I personally believe they have reduced the prevalence of some of the diseases. Have some of the diseases reduced on their own naturally? Yes.
Right.
Have the jabs helped? I believe yes.
I do too.
And so I think it's hard to get a really good idea of what the true prevalence is. And then also a lot of the data we have about the diseases and how severe they are, medical treatment was a lot less at that time. So for example, like treatment in the mid to early 1900s was not as advanced as it is now. And so people who might contract the diseases of the early 1900s to mid 1900s are going to have more advanced treatment and may have better outcomes.
Right.
So I think it's really hard. So like I said, it's not black and white. It's very difficult. It's a very difficult decision. But with that being said, I do think that oftentimes with not just the jabs, but like medical interventions in general, people that are not in the medical field tend to downplay the severity of things.
Yes.
And I don't think they're necessarily doing it on purpose. I think they just don't have the perspective and don't see how severe things can get. And I don't necessarily think they're doing it nefariously or to like intentionally try to sway people. I just don't think that they truly know. And if they were to see the diseases in action, I think their viewpoint would be very different. And like the anonymous comment on the Gently Led Sisters chat alluded to that, and I completely agree.
Well, because she's in the medical field.
Yeah.
So she does see a lot of the severity of things that they're supposed to be preventing. So, and I think we do. I think we live in our own little stay-at-home, crunchy mom, chickens out in our backyard life in our own little bubble, and we don't see that stuff. It is something to be considered, for sure. Yeah, and I've taken everything into account when it comes to my own children, because you are right. I completely agree. So yeah, that's what we will do. Your own research and pray about it. Let the Holy Spirit guide you. And it can be a little scary at first, especially. And I think this mom had younger, if I remember right, she had a younger child. So it's very scary at first. But what can you refuse at birth when it comes to medical stuff? What are some things that you would encourage? Okay, let's put it this way. This is all about balance. What are some things you would encourage to do, knowing, from your perspective, and I'm not talking Rhogam because we already covered that, but in the hospital when you give birth, what are some things, maybe even that you've done or things that you haven't done or whatever?
Yeah. So the three things that are like typically given in the hospital at birth, and actually a lot of hospitals just have what they call nursing order sets or nursing protocols, where they don't even have to have an order from a doctor. It's just a protocol that a nurse can order and administer these three things to babies. And that is the hepatitis B shot, the erythromycin eye ointment, and the vitamin K shot. So I personally completely do not do hepatitis B and the eye ointment because I do not have sexually transmitted diseases. So my kids are not going to get hepatitis B from me, 0% chance. And the eye ointment is to prevent the transfer from a mother to a baby of STDs.
Yes.
If you do not have STDs, there is no reason to do the eye ointment, and there's no reason to do hepatitis B. Zero reason. They started doing that just across the board because there were I don't know the actual percentage, but there was a large enough number of babies being born with congenital STDs of their eyes that led to blindness because mothers weren't being routinely tested, or mothers weren't getting prenatal care, that they were just saying, okay, the erythromycin eye ointment is pretty benign. There aren't many side effects, so let's just give it to all the babies. That way, no babies will have blindness from their mother's STDs.
Right.
But if you know that you don't have STDs and you know you don't have hepatitis B, then you can very safely not get those interventions for your babies. Right. Vitamin K is a little bit controversial. I will say a little bit about it. So this kind of goes into some of the arguments are, God made us a certain way, and so we shouldn't interfere. If babies were supposed to have vitamin K when they were born, God would have given it to them. So there should not be a reason to supplement. So that's one of the thought processes. But the reason vitamin K is administered to babies at birth is because Vitamin K is required to make clot factors. So there are vitamin K dependent clot factors and non-vitamin K dependent clot factors and clotting factors. And humans do not produce their own vitamin K naturally. Some animals and bacteria, they produce their own vitamin K. Humans do not. So we have to consume that through our diet.
Right.
Infants, vitamin K, for whatever reason, is not extremely concentrated in breast milk. So formula is fortified with vitamin K. Breast milk has very, very low concentrations of vitamin K. And they have done multiple studies, even in women that consume a very, very high vitamin K diet. The concentration in the breast milk does not reach the significantly high concentrations that will then get passed on to the infant that will be high enough to raise their level to produce clotting factors. Mm-hmm. So it has been tested. It's not just our bodies just don't naturally, at this point, maybe a long time ago when our diets were different and not full of processed foods and, modified fruits and vegetables.
Yeah, exactly.
Our breast milk contents may have contained high enough levels of vitamin K, but in the world we live in today, they don't.
Right.
And so babies need to have vitamin K in order to produce these clotting factors. Without the clotting factors, they can have significant bleeding. And there's two categories of that. There's significant bleeding that happens within the first 7 days of life. And then there's significant bleeding that can happen several months later. So both of those, vitamin K is recommended to prevent both of those. So you can go about it in two different ways. You can get an injection, which is given intramuscularly, or you can give it orally. Intramuscular is what's recommended, but oral is an option. I guess the downfalls to the injection is it's an injection and it does cause pain. Some babies can have mild reactions to it. I will say that a lot of people say that the vitamin K injection has a black box warning for fatalities, and that's why they don't want to give it to their babies. However, the black box warning for the vitamin K injection is specific. The warning came from specifically very high doses given to adults for the reversal of Coumadin. So it was not fatalities associated with the low dose that's given to infants at birth. So to my knowledge, there's only been one reported case of any type of anaphylactic reaction in infants in the history of vitamin K, like one reported case study.
Wow.
So the black box warning is specific for the doses that are given to adults, which are much, much, much higher. That, yes, there is a black box warning, but it's not applicable to the dose given to infants. Also, another thing, so that's the downfalls. It is an injection and there is a black box warning, but I consider that to be a misnomer. It's not applicable to infants. With oral, the downfall is you have to be very consistent and make sure you stay with the dosing regimen. So if you don't, and you don't give it on the days you're supposed to, and don't give the doses you're supposed to, then it's not going to be effective.
Right.
So there is that concern. And also you have to make sure your infant takes the whole dose, which babies spit up, spit out things. You try to give them things. So there's concern with that. And also the absorption of vitamin K in an infant's stomach and small intestines is not super fantastic. And so there's concerns about how much they're actually absorbing. And especially in younger, like preterm babies, there's concern about the absorption of the oral vitamin K. So it's definitely an option You just have to be very vigilant that it's given appropriately, the dose is given appropriately, it's given for the full amount of time it's recommended, and that you ensure that your baby does actually swallow it and ingest it and not just spit it out.
Right.
So
Yep.
a lot of people opt for oral, a lot of people opt for the injection because it's one and done, and you don't have to worry about making sure they're getting oral doses consistently. But if you don't want to do an injection, the oral doses is an option. And I would recommend one or the other, either oral or the injection. I have personally seen infants that have bleeding because of vitamin K deficiency. And a lot of times the bleeding is severe, and what we really worry about is the head bleeds. And if your baby has a head bleed, they're more than likely going to have negative outcomes from that. They may not die. They may die, but they may not die, but they may have long-term, like serious consequences from that. What the vitamin K, also something else that people worry about is that it has preservatives, but most of the time, if there's not a drug shortage, the vitamin K that's being used for infants is preservative free.
Oh, nice.
So there's like a specific vitamin K injection that's formulated for infants that's preservative free.
Oh, nice. That's good. That's
So
good to know. I did vitamin K injections up until my very last. And with her, I decided to do the drops. And you are correct. It's very specific. Like, what is it? Like the first, within a certain amount of time they're born, you have to do like 10 drops. Or we had to figure it out. Like the nurse actually helped me figure it out. She's like, you're one of my only patients that's ever done this. But she said that she had done it with hers. And so she kind of knew the dosing, and she got me set up with it and everything. She's like, I'm really not supposed to be helping you, but I'm going to do this. I'm going to help you. So she helped me. And then, I had to make sure I stayed on top of it. It was, how long is it that you have to do it for? Is it for a week?
There's a couple different dosing regimens. So it would depend on which schedule you're following and which dosing you're giving, which dosage you're giving, would determine like the regimen that you do.
Might have been a couple of weeks. I can't remember. I remember even after I went home, I had to stay up with giving her the vitamin K drops. But yeah, because I live in Illinois, I did have to sign off on a lot of that stuff, and I know that makes people kind of uncomfortable. I personally, they brought me in a paper that said I agree to the fact that my child could die from lack of vitamin K injection. I did not sign that. I just left it there, and they never bugged me to, because I'm like, I'm not going to sign that. I'm like, no, I'm not doing that. But the other ones that said I am willingly rejecting whatever the hepatitis B shot, I signed that. But so moving on, I don't even know if we're going to get through all this. I'm going to try to, what are some of the things we really wanted to cover?
Well, I really wanted to cover just like with medical things in general and kind of people's perspective on.
Yes, I want to cover that.
On like God and protection and different views on that.
And just demonizing the whole medical field as a whole.
Yeah.
And this reminds me, I wanted to say something about how you said a couple times a lot of things that you hear. It's, well, we just need to let nature run its course. If God didn't want us to have vitamin K, we wouldn't have vitamin K. Can I just say that thinking in and of itself is flawed, because we live in a world, a sin sick world. Okay, first of all.
Yes.
Second of all, things are not getting better when it comes to our food and the things in the air and the stuff in our water and all the chemicals just in our clothing and our, everywhere, just the chemicals everywhere. Things are not getting better. And so to say that, it's almost like, yes, maybe if we were in the Garden of Eden, yes, I could see that viewpoint, but we're not. It's a long time since the Garden of Eden, and a lot of stuff has happened since then. So we constantly have breakdowns of genetics, and we're not like a pure blood race. No, we're all intermingled. We all have different genetic things going on. So to me, that's just a flawed reasoning anyways.
It's very flawed. And when God created man, he didn't create man to have alloimmunization
No.
or blood disorders,
Right.
or there were no bacteria, there was no sickness, there weren't viruses and bacteria. None
Yep.
of those things existed until after the fall.
Exactly.
So when God created man, these things weren't problems. These are all the result of sin and all the result of the fall of man, like you were saying.
Yeah.
Now I want to put a caveat in there. I said it's a result of sin. I do not mean that you are sick or you have a sickness or your baby has a sickness because you personally sinned.
Right.
Although there's definitely times where I believe the Lord does that for chastening, but I don't think that is the case for the majority of sicknesses.
Right.
I think that it's just a result of sin. We live in a fallen world. Chance happeneth to all. Things just happen.
Yep.
I don't think that God is up in heaven just like saying you get a disease and you get a disease and you get this sickness and you have this birth defect and you like, I don't think he's up there doing that. He's not, we're not Calvinists. We don't believe it's all basically because of the fall.
Yeah.
And chance and free will and
Mm-hmm.
And I do believe that we need to trust in the Lord and safety is of the Lord, but he also said to sell your garment and buy a sword for protection. And so we do need to take measures to protect ourselves, whether that's in health or whether that's with like physical violence. And we do need to do things to keep ourselves safe. We don't want to live a reckless life and say, I'm trusting the Lord and I'm not going to take any precautions with my life whatsoever because I'm trusting the Lord to keep me safe and I'm trusting the Lord for my health. I think that's very reckless. And my husband's preached several sermons on not tempting the Lord. And I think that goes into like your health, with like medical things, but also just like safety in general, not living a reckless life. And I think it's important to take precautions and to do like a good in-depth risk versus benefit when you're making big decisions.
Right. Because are there times when you personally will take the natural route versus conventional medicine?
Yeah, definitely.
What are some things that you won't mess around with? For the young moms out there, I do want to touch on this. Like, what are some things you are going to absolutely, I'm taking my kid to the doctor. I'm getting an antibiotic, whatever, whatever it is.
So, okay. So I'll touch on, I guess, when what's an emergency, like when you should truly need to go to the emergency department. So if you see signs of severe dehydration, so that would be like if your child has been vomiting or has had diarrhea for like a couple days, or it could be even 24 hours, depending on how severe it is. Their mouth is dry. So mucous membrane. So you're thinking like their mouth, their tongue, their eyes, they're not producing tears. They haven't produced urine in 12 to 24 hours. That is an emergency. And if you aren't able to get them to eat or drink any amount and you notice signs of dehydration, especially in babies, that would be considered an emergency where you need to take them in to get fluid. You don't want, especially in babies, you don't want dehydration. So monitor those wet diapers, monitor what the inside of their mouth looks like, what their lips look like. Are they producing tears? Another time that would be an emergency is if they had any type, and I feel like this should be obvious, but I'm going to say it anyway. If they have any type of injury that you think there's a broken bone.
That's not obvious. A lot of people still won't.
Well, if you feel like your child has a broken bone, or if they have like a deep wound that might need stitches, I would take my kid in. Some people would say that like the wounds will heal on their own, which they might, but they'll heal a lot better and a lot faster and a lot cleaner if you get the wound cleaned out and you get it appropriately sutured or glued or however they're going to do it. So bones can heal themselves, but they're not going to heal appropriately and they could have long-term major issues if you let a broken bone heal on its own. That's not, some bones the doctor will send you home and say like, I can't do anything. but a lot of times they'll splint it or cast it and put it back into place. And without x-rays or proper diagnostics, you're not going to, from being at home, know if this is a break that can be just left on its own to heal, or if it's a break that needs surgery, or if it's a break that needs a cast. That should be looked at. I would also say any type of seizure activity should be seen.
Absolutely. Mm-hmm.
Any type of, okay, so I'm not going to say head injuries always need to be seen, but when in doubt, definitely take them in. But things to look for if there's a head injury, if they lost consciousness, they should be seen. If they have vomiting, confusion, if they're just really tired and hard to arouse, if they have a seizure after they hit their head, or if they have any type of like bleeding, I would recommend going in emergently for those. Some head injuries you can stay at home and watch and wait your kid. Watch and wait before you take your kid
with
in.
some, but yes, some make me nervous. Does the pupil thing work?
Oh yeah. So if you can look at their pupils and one pupil is more dilated than the other, or if their like eyes are doing anything funky, those are definitely times where you would want to take them in. I mean, there is a time where you can be like, as a mom, very concerned and feel like have a gut feeling. If none of those things are happening, but you're just really worried, take them in. Take them in.
I'm not even a pharmacist, and this is exactly the protocol I follow in my own life, and I have with all of my kids. And there have been times when my gut, I just knew I needed to take them in, whether it was for a bone or whatever. And fractured wrist. You know, there's been times when I've needed to take them in, a fractured leg. I think Kelly had a hair. Yeah. Did you see the question? Yes.
Jason shot the deer, and it's an 8 point. I saw. He got the deer. So he opened our sliding door and saw the deer, and like he didn't even get into his tree stand. He just shot it like right behind our house.
Oh my goodness, that would make my husband so jealous. He noticed that. He never even watches my live stream. He probably popped on and saw the deer. He's like, he had to ask that question. That's so funny. No, I agree with all those points. Fever, though, because I know a lot of moms freak out about fevers. So what about a fever? How high? How long?
Yeah, so I usually don't consider fevers to be emergencies. I personally just watch how the kid's doing, and this is going to be individualized. So if your kid has a fever, that means they have some type of infection usually. Bacterial, viral, it's going to depend. But I would try to figure out what other symptoms they're having. A fever by itself wouldn't necessarily be a reason for me to take the kid in. There's not really a specific number that I would be worried about per se. Like a lot of people say really high fevers can cause seizures. That's a misnomer. It's not necessarily how high the fever is, it's how fast the temperature raises.
Right.
So like a very quick jump from normal to really high can cause seizures. Or even just a quick jump, not even to really high, but just a quick jump. And that is going to be hard to, a lot of times you're not even realizing it's happening. So it's a harder thing to prevent from happening because you don't really always know. You're not like with a thermometer in your kid's ear all the time checking their temperature to know how fast it is happening. But just because your kid has a high fever doesn't necessarily mean they're going to have a seizure. And it also doesn't necessarily mean you need to take them in.
Right.
I would say if it's like 105, I would start freaking out. Like,
that's my cutoff is 104. Yeah.
I would start feeling uncomfortable.
Yeah.
But actual brain damage doesn't happen until much higher than that. So
okay, that's good to know.
They're usually you'll go in with a high fever. They'll probably give you Tylenol and ibuprofen and monitor you and then potentially send you home if your only symptoms of fever.
Yeah.
But if you have a fever with other concerning signs, so like difficulty breathing would be a time where I would take my kid in. And a lot of times that can be hard to recognize in babies. I mean, you can tell when they're having difficulty breathing, but like retractions where you can see the muscles in their ribs sinking in when they breathe. I would like recommend going on YouTube and looking at videos of kids that have retractions to get a good idea of what that looks like. Because that's a very important sign for kids having retractions. Or you can see it in their neck if like right here is sinking in when they're breathing deeply. That's another sign that they're having difficulty breathing. And wheezing, which can be hard to hear the difference between wheezing and like congestion. Sometimes that can be a hard thing to differentiate between. So if you're not sure, just take them in and get them seen. And if it's not wheezing and not retractions, at least you'll have the peace of mind that it's not.
Right.
And if it is, then you can get the treatment that you need. Let me think.
My rule of thumb with fevers is I treat at home unless it goes away and a few days later comes back. Just due to secondary infection. So I will
agree with
take
that
them
for
in
sure.
as far as like just to make sure to rule out pneumonia or, you know, any type of thing like that. So just because once again in my that's happened with some of my family members. They ran a fever, stopped, it came back, ended up being a really, really bad case of pneumonia where they had to be hospitalized. So with my kids, that's my rule of thumb.
Yeah, definitely if your fever comes back, or if you have a fever for a really long time and it's just not breaking, something's up, like you probably get checked out. I wouldn't necessarily go to the hospital for that. I'd probably just go to their pediatrician.
Oh yeah.
I'm trying to think. So when I would take my kids to the doctor, so if they have any type of like eye injury, I would take them in.
Yes.
Ear pain is tricky because a lot of times ear infections are viral and don't need to be treated with antibiotics.
Yep.
So ear pain is really tricky. That one's tricky. You just kind of have to, a lot of times it doesn't require antibiotics. So I don't want to say like, don't go to the doctor if your kid has ear pain, but it is true that a lot of ear infections are viral. So even if they do have an ear infection, there's a pretty good chance they might not even need antibiotics.
I know. It's so hard. Abigail, though, my almost 20-year-old works at a daycare, and she did just get an ear infection that she tried let going. And she ended up having to go to the walk-in clinic for it, and she had to take a round of antibiotics because it was not going away. And she told me, she's like, if this is the reason I cried so much when I was a baby, because she had chronic ear infections when she was a baby until we got tubes put in her ears. And then she never had another one again until she was almost 20. But she said, if this is the reason I cried all the time, then it was for good reason, because this is excruciating. So
ear infections, I don't want to say they're common in kids, but the like shape of the eustachian tube and the way that it drains is much smaller, much less effective in babies and kids. So they are kind of prone to that because that fluid will like sit in their ear canal and or their eustachian tube and doesn't drain properly. And if any type of like bacteria, like if it's swollen from allergies or if it's swollen from just like any type of sickness that they could get, common cold could even do it. And that fluid's not draining, a bacteria gets stuck in there, it could lead to an infection. So it's much easier. And they are very painful.
Yes.
So when it comes to like treating pain, in my kids, I try first, depending on where the pain is, to use like ice packs or warm packs. Or so I'll have like different creams and stuff I'll like rub on their legs. But I will tell you that pretty much any natural remedy I've used for pain is not effective for my kids. Like it might temporarily dull the pain, but and I do use it. Like my kids have like really bad leg pains at both two of my kids. And so I always start off with like using ice packs, or I'll use like magnesium cream, or just lotion, like rub, massage their legs. Sometimes we'll use like heat packs. I would say like 75% of the time they come back crying that they're still in pain and those things don't work. So I'm not saying like don't use ice packs or don't use heat packs because that's my go-to first, but I personally haven't found anything super effective that's not ibuprofen or Tylenol, which I don't really love giving my kids that. But when they're up in the middle of the night crying in pain and not sleeping, I'm going to give it to them.
Yep, same. That is the only thing I found to work, even for me personally, honestly, is that. So, let me see. Okay. How do we not get into the rut of just antibiotics over and over and over and over again? Yeah, because I know that is a concern.
Yeah, it is.
You know, the overuse of antibiotics. However, I do believe that there are some things you need antibiotics for, such as with younger kids, strep throat. I'm going to say it. Me and my family are very susceptible to strep throat. For me personally, I asked you about this if you had ever researched oregano oil. The P73 Mediterranean wild picked oregano oil, it has taken away my bladder infections, strep throat. But I don't do this with my kids because they can't swallow capsules of oregano oil, for one, and they can't swallow oregano oil. It's too hot. It's too hot of an oil.
Potent.
It's a very, very hot
very,
oil.
very
So
potent.
I put mine in capsules. And I'm not going to experiment with that on my kids. Me, that's a whole nother. I know what I'm feeling. I know if it's helping, that's another thing. So when it comes to strep throat, I don't mess around with my kids. I will take them in and I will get an antibiotic for them. Is there anything such as ear infections? You touched on it. Do you feel like there's any more area where there's overuse of antibiotics?
Yeah.
And what would you suggest otherwise?
I feel like just the common cold and the flu, frequent people, they'll have like a really bad cough, they'll have like a snotty nose, runny nose.
Yeah.
And they take their kids in or they'll go themselves and they'll get antibiotics and steroids and cough medicine. It's like they go to urgent care and that's just urgent care's script. Antibiotics, steroids, cough medicine, inhaler, and they send them on their way. Usually most of the time, I would say you just have a virus and you need to just like wait it out at home. But recently, my kids and I all had this horrible head cold. And this was like a couple weeks ago, actually over our anniversary. So we all had this awful head cold and my kids were over in a couple days and I started to feel pretty like significantly better in a couple days. And then like 2 days later, I had horrible face pain, like really, really, really bad sinus pain, really bad sinus headache. My teeth hurt, my ears hurt, like my hearing was affected. And so I knew I had a sinus infection. Like I knew that it had settled in my sinuses. And so I went and got an antibiotic for that. But that was kind of like what you were talking about where your fever reappears. This was like my symptoms got better and then got worse.
Yep.
So I at that point knew, and I hadn't had a sinus infection in a really long time, but so stuff like that where maybe you have something and then you get worse, start to get better and then get worse. But I rarely take my kids in unless it's like something that just won't go away. It's just lingering. Or if they've had fevers for a long time, like over a week of fevers, or if they're like complaining of significant pain. Like Anna, I don't know, beginning of the year, I took her in because I thought she had a sinus infection. It was the same thing, like her face hurt. She cried that her head was hurting, and everybody else just had like mild cold symptoms, and she was like crying in pain and like holding her face.
Yeah.
So it's really just like a case by case, but I would say antibiotics are overused mostly for like respiratory stuff, the common cold. People go in because they have a cold, and then the doctor like, oh, you have bronchitis, or oh, you have a sinus infection, when really they just have a cold and just wait it out.
That's a good point. Case in point, I was kind of embarrassed in a way because most of the time I take my kids for the first year after they're born, especially since we've lived here, to establish a relationship with their pediatrician for well babies. I don't get the jabs or anything, but I do take them in that way. I just have a relationship with him. Chloe had this weird rash on her leg this summer that was not going away. So I took her into the walk-in clinic and they looked her up in the system and they could not find her. Come to find out, the whole 13 years we've lived here, she's never gotten sick or needed to go to the doctor. And so I felt like this, like, but I told the receptionist, I'm like, she's never sick. And Chloe's like, I really am not. I'm never sick. So they were like, well, we would encourage you to take her to a pediatrician on file just so she's in the system, basically. But some of my kids have just not needed it very much because they really are never sick. But Sarah posed a good question. She's curious. What are your rules as far as staying home with sicknesses, like for church? Like we all kind of have our own thing.
Yeah.
What is your guidelines for your own family?
So, if we're sick, we stay home. Those are my guidelines. I don't like, even if my kids don't have a fever, but like if they're snotting everywhere and hacking everywhere, like especially little kids can't cover their cough.
Yeah.
And like you go in the mother baby room and they're just like snotting on all the toys and like gagging everywhere. I'm gonna stay home. That's just me personally, because even if our like sickness isn't severe and it's just a cold, like nobody wants to deal with that. I mean, I don't know. I just, if we're sick, we stay home. Definitely if we have fevers or if there's like throwing up or diarrhea, like no
Oh,
question.
yeah.
But
Those
even
three
if
things. Yeah.
even if they're like if they have a gross cough or if they're like sneezing everywhere, I'll keep them home. Specifically the little kids. Like Claire is old enough that if she's like still has a cough or whatever, she knows to cover her mouth. She knows to like blow her nose, leave and blow her nose in the bathroom and wash her hands. But like the little kids, they don't they
No.
don't know that. So I don't want them like snotting on everybody. That's just really gross.
I kind of go by like most of the time, if my kids get sick, it's because everyone else is sick.
Yeah.
So, like, if
Yeah.
it
I mean,
comes
it
to the
spreads.
common cold, if everyone else has it and everyone else is hacking, I'm like, who cares? Whatever. But I don't want to ever be the one to start it.
Yeah.
So, if my kids, if I don't know of anything that's been going around, I might, as a precaution, stay home with someone with one of the babies who's hacking. But most of the time, I feel like everyone gets it. But yeah, definitely
Yeah.
puking, diarrhea. That's an automatic stay home. Fever, that as well.
Yeah. And I mean, there's definitely times where like we've gone to church and then halfway through the day, one of my kids has a fever.
Right. Sometimes it pops up.
Or like you don't,
Yeah.
they wake up and they seem fine, and then you get there and they're
Yeah.
like really miserable. Like obviously we didn't plan that. Like we
Right.
didn't mean for them to come miserable.
Right.
And we've also been the culprit of like spreading things at church where we thought we were in the
Unknowingly.
clear and
Yes,
didn't
I
think that we were
know.
contagious anymore. And we were. So
Yeah, it happens.
I mean, if we are like actively sick, we stay home for multiple reasons. One, I don't like spreading stuff. And two, like my kids are just going to be miserable.
Yeah.
Like if my kids are sick, I'm going to be in the mother baby room the whole entire time. And then my snotty sick kids are going to be in the mother baby room. Like it's just going to be a very miserable time for everybody involved. Myself, my kids, the church members. So if
Yeah.
we're sick, we stay home. That's just,
I feel like when you have little guys, it gets better. Ladies, it gets better. Okay. I very rarely have to miss because of sicknesses now, but my youngest is 3 and my oldest ones have had everything. So when they're little, you feel like they're always sick. Like
yeah, like
someone
we were
always has
just talking,
something.
we have had some sickness every single month this
Mm,
year. Like it's like
yeah.
it hits us and it takes like 2 weeks or more to get through everybody. And then we have like a couple good weeks of health and then something new comes the next month.
Yes, exactly.
Yeah.
Hauser, I saw this was still live and pulled it up and see they are talking about an 8-point buck in the chat. I missed a good one. I'll have to rewatch. That literally took 30 seconds talking about the 8-point buck,
Yeah.
so don't get excited.
I was gonna touch on something related to antibiotics. That's
Yes.
okay. So
Hmm.
I did kind of want to just like briefly mention not any specific like natural remedies because I know you've done like multiple shows on that, but
Hmm.
or like had people on to talk about that. And I will say I'm not against natural remedies. I'm not against herbal supplements and stuff like that. When it comes to infections though, I won't like bore everybody with the science behind it, but there's different ways to kill bacteria. So there's time dependent, there's concentration dependent. So you either have to have the antibiotic in your system for a specific amount of time, or I don't want to say antibiotic, whatever you're using that'll kill the organism, or you have to reach a certain concentration.
Okay.
So with like a lot of herbal supplements, they're not formulated in a way that you can take it once or twice a day and be good to go. With a lot of herbal supplements and natural products, you have to take them pretty much around the clock for an extended period of time to completely clear the infection.
Yep.
So you might kill the infection enough to start feeling better. And this goes with antibiotics too, whether it's natural or actual medicine, you might take it long enough to kill it. So like after 2 days, you're feeling great.
Right.
But it's important to take it for the entire course, whether that's 5 days or 7 days or 14 days, depending on what you're treating, because you want to get rid of it all or make sure that it's all killed out of your system. And things can kill bacteria different ways. They can be cidal or it can be static, which basically one completely kills the organism and the other one weakens it and stops it from replicating. So if you're just stopping it from replicating specifically, it's going to take a little bit longer of a treatment. So I think that's a misnomer. They're like, people will frequently use like herbal things or even antibiotics, and they'll say, okay, I feel better. That means it's gone. But it's not, it's still there. And it might not ramp up and reappear as a full-blown infection, but the bacteria or virus or whatever can still be in your system. And one of two things can happen. One, it can come back later as a reinfection, or two, now it's been exposed to whatever treatment you had and it developed resistance to it because it's smart. And it's like, okay, this didn't kill me. I'm going to mutate and become resistant. And so then next time when you try to use that same treatment, it won't be effective anymore.
It's very interesting because a little personal story, back when I was getting chronic bladder infections after Abigail was born, so this was almost 20 years ago, I would be on 10 days of antibiotics and my bladder infection would go away. And as soon as I was done taking the antibiotic, 3 days later, it would reappear. I know, you're just reading my husband's comment. And then, sorry, babe, that's not the topic tonight. Hunting is not the topic. And then I would do another 10 days of antibiotic. And then 3 days later, it would come back. And then that did for 3 or 4 rounds. So one thing I've done, so I ended up having to do this super, I don't know what it is, the most potent antibiotic out there that there is. My doctor prescribed and said, if this doesn't work, we're going to have to do a scope and see why you're getting all these bladder infections. Thankfully, it did work. But then I went about 10 years without one. And I got it. By then I knew about the powers of oregano oil. I'd researched it and seen all the lab studies that they had done, comparing it to amoxicillin, penicillin, different things like that. The way I take my oregano is the same way I take an antibiotic. I do it 3 times a day for 10 days. So I do it the full 10 days, even though I feel better 24 hours into it. Yeah. I do it for the full 10 days and I've never had one come back. Like I'll go 5 more years after that, 7 years, not like I did. So for me, it works very effectively. But do you think part of even antibiotics or natural remedies could just be due person to person too? Like each person's different and each person reacts differently to it.
Yeah. So I wouldn't necessarily, when you're using an antibiotic or natural remedies for an infection, it's going to be organism specific, not necessarily person specific. Like your body can react to it differently, but whether or not it kills or gets rid of the infection has to do with the organism itself.
Right.
So every urinary tract infection is not going to be caused by the same bacteria. There's a whole slew of bacteria that can cause that. And so, doctors will prescribe an antibiotic that they think might work, but depending on what the bacteria is, it might not even work to kill that specific bacteria or virus, or
it was terrible,
fungal, whatever. There can be lots of different things that cause infections. So same with natural remedies. So like not all natural remedies are going to be effective against every bacteria that can cause an infection. And another thing to take into consideration too is how well this is antibiotic or natural remedy how well it's able to penetrate the site of infection. So like if you have an abscess, for example, it's going to be significantly harder to treat than if you have a urinary tract infection, because your urine is produced basically from clearing out your blood in your kidneys.
Right.
So most things are filtered out, not everything, but most things are going to be filtered out through your kidneys. So it's a really, really easy source to treat.
Right.
Whereas if you have an abscess is like a loculated pocket of infection, and that's really hard to penetrate.
Right.
Your lungs are also really hard to penetrate. Your brain's really hard to penetrate. So, a lot of natural remedies aren't going to aren't going to have the ability to penetrate those harder sources,
Right.
or locations, just because they're not going to reach concentrations high enough.
Right. No, that makes sense. Totally makes sense. Yeah, good points. I do want to hit on this before we are done. Baptists, especially in this homeschool, stay at home mom, the man is the provider, we can sometimes tend to elevate stay at home moms over that of any girl getting any type of form of higher education.
Yeah, I'm glad.
Higher education past high school. Me personally, I love to learn. I absolutely am constantly trying to learn, read, research, different things like that. Someday I might go back to school. I don't know. We'll see after my kids are grown and gone. But how do we find a balance? Because there's so many women, especially Baptist women. I know I prefer this. I go to a woman midwife. I have a woman doctor. A woman doctor performed my ECV with Hannah. I've had women, with the exception of my one male doctor who had to deliver Abigail because she was breech. She was born breech. And he was well gifted, well skilled in delivering breech babies. So he helped my woman midwife. So we're all for having women as midwives and having women for doctors. So how do we find the balance between not throwing the baby out with the bathwater? So realizing if we want women midwives and women doctors, we need someone to go into that field.
Yeah. So I think that I'm really glad you brought this up. So there's been a shift. And I think the pendulum has gone too far in one direction.
Yes.
And
amen.
we no longer have, or I don't want to say no longer, but the balance is no longer there, where we've gone from like pushing higher education, and now we're like swinging the pendulum this way, where we're like, okay, higher education is wicked, and it costs $1 million, and it's just a money scheme, and it's not worth it, and nobody needs to go to college. Like everybody should just find a trade job and do trade work, and women should stay home and raise the kids and homeschool their kids, which I agree that women should be home homeschooling and raising their kids. However, and I do agree that college is expensive, and I do agree that there's a lot of degrees that are worthless. But there's a lot of professions that require degrees, and you have to have higher education, or you're just not going to be able to get hired or get licensed or be able to do those. And the medical field is a really good example of that. And I think that we should, I don't think that everybody needs to go to college, but I think that if we have kids that are interested in the medical field, that we should encourage that and help them gain the skills while they're homeschooling, like help them take electives that they're interested in, or help them take those higher level math courses or higher level science courses, if that's what they're interested in, to set them up for a path to be able to do those things. Because like you were saying, if conservative Christians, if there are none of us that are going into the medical field, then how are we going to expect to get a conservative doctor or a female doctor to perform our female checks, or to deliver babies, or to be midwives? And we don't want to have midwives that aren't skilled. We definitely want midwives and doctors that are skilled and know how to do what they need to do, and that are knowledgeable. And that requires training. And so I don't think that we should just throw the baby out with the bathwater and say all college is bad, all higher education is bad, because those jobs are needed. And I think that it's important that we have conservative people in those roles.
Yes.
You can't, it's like it's not a two-edged sword, but there's a double standard. Like you can't require your wife only sees a female OBGYN, but then demonize females being OBGYNs.
Exactly.
You can't only want to see a conservative doctor or a pediatrician that has conservative views, but demonize people going into the medical field. Like you can't have both.
Right. Right.
So the only way that that's going to continue is if we if we have kids that are interested in that, if we encourage them to go down that path. And I'm not saying like push your kids down into a path of medicine, but I'm just saying that there are other careers, but in white collar jobs and blue collar jobs, like there's both are good. And like I would say encouraging your kids to have a good work ethic and whatever they're doing should be our goal. But if they have that interest, then encourage them and let them do that. Like those careers aren't wicked. They're not bad. They're actually very needed. And I think that the more our world spirals down the path that it's spiraling, the more imperative it is that we have good conservative doctors and dentists and nurses and midwives and all of that. It's very necessary. And I would also say, like, I'm not against male nurses by any means, but I feel like most people feel more comfortable with female nurses. But if you never encourage any females to become nurses, then you're going to be left with all male nurses.
Right.
And only male doctors and only, I mean, I guess a guy could become a midwife, but like only men performing those tasks. And I think that the majority of us would agree that, especially as women, we feel more comfortable with a female.
Yeah.
Being our OBGYN or being our nurse or just being our doctor in general.
Exactly. And I have to say too, one thing that I've always tried to get across on this show is we need to be very careful not making things into sins that aren't sins.
Yes.
And I do agree. This is a show for encouraging stay-at-home moms, stay-at-home wives. Obviously, I feel like that as a woman, the Bible says, it gives encouragement to women to be wives and moms and all that. But if you have a 19, 20-year-old girl who is single, still at home, and it has an interest in midwifery or, other things, and she wants to pursue that, I would be very cautious making that into a sin when it is not a sin. If there is no man available and no man pursuing her, and, she's in the meantime, she is pursuing other options, keeping herself busy instead of pining away for this husband that's not there. I would rather have my daughter pursue higher education than being depressed and pining away for something that's not there at the moment. So I don't know. We have to be really careful into not making things sin and being over the top about things because you're right. Whereas, being a stay-at-home mom is wonderful, being a wife is wonderful, all that stuff is wonderful. It's not a sin to be a midwife or to be a nurse or to be a doctor or, nowhere does the Bible specifically forbid women from doing any of those things.
Right. So. I would probably be more cautious with allowing our daughters and sons, but allowing our adult children to sit at home and not being productive, whether that's working or whether that's doing education. Because that age after high school, but you're in an adulthood, but you're not married yet, like we wouldn't want them to become lazy, to become busybodies, to just sit on social media all day. Like they need to be doing something.
Yep. Amen.
And I obviously don't have kids that are anywhere near that age, but
I do. And I agree completely with you.
I know just from, and I was in college, but just from being a young adult, it's easy to get sucked into social media or get sucked into whatever. it's important for them to be busy doing productive
Yes.
things and gaining
Absolutely.
skills, as opposed to sitting at home twiddling their thumbs.
I agree. I have almost 4 adult children now. And one thing that my husband and I strive to do is we strive to keep them very busy. And so people might, you give your kids way too much freedom. I don't give them, they're adults. And as long as they are living in a way that we approve of, there's not really any discussion that needs to be made. But even with Abby, some would look at her and she works at daycare. I can't believe you should be teaching her how to run the home and teaching her to cook and bake. Well, she knows how to do all those things.
Yeah.
And there's only so many cakes that you can bake, there's only so many times you can vacuum, and she needs to be kept busy. So I'm a proponent of keeping adult kids busy, whether they're guys or whether they're girls. They can be learning things. She works in childcare. She works with all other females, and she's learning child management skills. And
Yeah, I mean, so by the time your kids reach adulthood, I would hope that at that point, and like I said, I'm not an expert in any way. I don't want to like give advice or speak out of turn because I'm not at that stage in my life. But once they've reached adulthood, you should be able to trust them to be in the
100%.
world.
Yep.
Because hopefully at that point we've like raised our kids to make good decisions. And so like I know a lot of people are against college because it's worldly or they're exposed to worldly things or whatever, but we live in the world and we have to know how to function in the world. And so by the time they've reached adulthood, they should know how to function in the world and make good decisions.
Yep.
So will they always make the right decisions? No, but you should trust them to at least know how to function in that environment.
Exactly. No, I've always said college does not ruin your child. College shows what is there.
Yeah.
Or moving out of the home does not ruin your child. Moving out shows what is there because it all comes down to what's in their heart. They're going to do what's in their heart. So if they become one with the world when they leave, if they become one with the world when they go to college, that's what was there. They're drawn to that. So
I want to say like Jason and I aren't planning to like kick our daughters out of the house when they turn 18 and be like, you have to go to college and you have to be a nurse or a pharmacist or an engineer. All I'm saying is if you have kids that are interested in that, don't necessarily squelch that fire. I think that it can be a good thing.
Oh, and while you say that, if you have daughters, you need to give them an education, not do this whole, well, they're learning math by baking. They're adding 3/4 cup plus 3/4 cup. So then they know that's 1.5. So that's their fractions for the day. Please don't do that with your kids. Please teach them. Please teach them.
So,
take it seriously.
I hear that a lot where mothers will be like, I don't care about my daughter's education because they're just going to be a mom.
Oh, but
Or
they're going to be
like
teaching
they
your
don't like, I don't
grandkids,
care how much they learn. Like if they just get through, if I can just get through homeschooling them, like it doesn't even matter. They're just going to be a mom. Well, being a mom is
just be a mom.
Okay, so we were just talking about like the jabs and stuff. Like, how do you expect your daughter to be able to decipher complex medical issues if you don't give them an education? Like, you're setting them up for failure.
Right.
I don't think you have to be the smartest person in the world. And I don't think you have to even necessarily have a background in medicine to be able to learn these topics. But you have to know how to read.
Yes.
And you have to be able to have reading comprehension and like basic knowledge. And if you're not providing that to your kids, you're setting them up for failure. Yes. And if you want your girls to grow up and be stay-at-home moms and homeschool their kids, how are they going to educate their kids if you don't educate them?
I want smart grandkids. So my kids need to know, they're going to be homeschooling my grandkids, hopefully, eventually. So exactly, Ron. Proverbs 31 woman was definitely, he's being facetious, but Proverbs 31 woman was definitely not intelligent and only understood baking.
Yeah. I think
with all that she did, running her side business and vineyard and going afar and merchant ships and sewing and organizing her household. Yeah.
Yeah. I mean, I'm not like a proponent of kicking your daughters out of the house and being like, okay, go fend for yourself and work secular jobs and go to college and get a degree in, whatever, gender studies or something.
Yeah, exactly.
But there's definitely times where degrees are useful and needed in society.
Right. Yes, definitely. And I think, like you said, obviously we're not being like Holly and I aren't raising this feminist flag and being like, go send your girls to college, but we're saying educate your children and be careful not to throw the baby out with the bathwater, because I, for one, want women midwives and I, for one, want a woman doctor and I want women nurses. So, if no women are going to learn these things, then, they're going to be men before long, all men.
And I will say, like, I don't think you are either. Like, we're not here to be judgmental if you have the stance of you don't want your kids going to college. And we're not here to be judgmental if you pick one medical intervention over another, if you pick natural over another. But I will say, if you in your heart believe that something is a sin, then don't do it.
Right.
But also don't place judgment on somebody if you don't have chapter and verse to back up your beliefs, because we all have liberty in these gray areas, and so there's no chapter and verse on a lot of these things, and so you have to make your own decisions and you have to be convinced in your own mind that what you're doing is correct, but at the same time, understand that other people are going to be convinced in their own mind that something else is correct. And if you don't have a chapter and verse to back it up, don't demonize them. Don't call them sinners because they're doing something a little bit different than you are.
And I would be very, very cautious when you are just reciting verbatim something you've heard, but rather not researched yourself. Be very careful pounding your chest and demonizing other people for that. So, yeah, which is one of the reasons I wanted to have you on, because while I have researched a lot of this stuff, and actually, like, everything you were talking about, Rhogam is the one thing I didn't know much about, but everything else you were talking about, that is exactly how I have lived my life without even being a pharmacist or in the medical field. But it's been through a lot of years of having children, my own experiences with medical professionals, good experiences, bad experiences, and taking my health into my own hands and looking into things for myself, So
I will say one last thing, and this is just kind of, I guess, like a tip for how to approach doctors or medical professionals. So a lot of times we, especially as parents, so I'll put into the perspective of a mom or as a parent going into a medical situation. A lot of times we have done a lot of research on things, and we go into the situation being very knowledgeable, or at least feeling like we're very knowledgeable on a topic. And if we come to the physician or to the nurse or whoever and automatically get very defensive and kind of like throwing things at them, throwing things in their face, and saying things like, I know more than you, I've done my research. There's a way to go about this that you can be kosher and be polite, and not cause big issues, or burn bridges, because I will say most doctors, there are bad doctors. I work with bad doctors all the time. There are doctors that aren't as good as others, that aren't as knowledgeable as others, and that don't have bedside manner, don't know how to provide information. They have a lot of knowledge, but they can't tell you about the knowledge that they have. So there's definitely doctors out there that are awful. And I'm not like downplaying anybody's experience with a horrible doctor, because there are doctors that are bad. But a lot of times I feel like we can make a situation bad that doesn't necessarily need to be bad.
Yeah.
So, I think it's a good way to go about it is to genuinely ask a doctor in a non-defensive way their advice and what their opinion is on a topic. Say you want to learn more about it, that you have a lot of questions and you want their advice, and just hear them out. Genuinely hear them out. And if you don't agree with them, just thank them for their advice and move on.
Yep.
Like, you don't have to get into this heated debate or argument with them. Just like take what they say, thank them for sharing, and then move on. Either find another doctor or just like don't discuss it anymore.
Exactly.
And that will definitely make the situation a lot less aggressive, and there's a lot less of a chance of there being a significant conflict if you go about it that way, as opposed to just like coming at them with like this big binder of vaccine inserts and hand it to them and be like, throw it in their face.
Right.
Like you can have those, and I encourage you to have those, but I don't encourage you to like throw it in their face. I encourage you to like actually get their opinion and their advice about something, and then you don't have to take it. You don't have to take their opinion or advice. You can just move on with your life and thank them for sharing the information with you.
Yeah. Sometimes Christians can be the biggest jerks. I'm just going to say it. You can be the biggest jerks to people you disagree with. And, we don't want to be jerks. We're supposed to be different than the world. So we want to be kind. We can be kind. I have a wonderful pediatrician, and he has not once given me grief over the whole jab issue. And he pretty much told me, I asked him his opinion on it one time, and he's like, I'm just going to tell you, I respect your opinion as a parent, and you get to decide. He's like, I think of myself as the dad who's telling his son, don't climb up that tree, you're going to fall. Don't climb up that tree and you're going to fall. And then I just have to sit back and watch. And if he climbs up in the tree and falls, then, it's on him. He's like, I am that dad. So I can tell you what I think, but at the end of the day, they're your children. And we have a very, respectful relationship because he has never pushed it. And he's made a lot of really good decisions when it has come to things with my children, things he's noticed, picked out that I never would have noticed. Things that he's identified. He always takes the lowest risk test first, and then we go up from there. And so I think sometimes we're way too quick to burn bridges and to cause scenes when we don't even need to.
Yeah.
We need to be careful about that for sure.
Yeah, I would just say be respectful, basically.
Yeah,
and you can have a different opinion without attacking them, because like I said, there are bad doctors, but the majority of doctors like legitimately care.
Right.
And legitimately are only making the recommendations because they truly do believe that it's the right course of action.
Right.
And like I said at the beginning, people that are in the medical profession, we do have a different viewpoint on things because we see the worst of the worst. Like, we're not seeing healthy people.
Right.
We're seeing sick and dying people. And so sometimes that can kind of give us I don't want to say twisted perspective, but
I think a realistic perspective.
A different perspective. Yeah.
This may be a realistic to the horrors that are out there with some sicknesses or some diseases or some side effects or some things that might not happen because you didn't do a preventative, so you're just kind of seeing the reality of people's decisions.
Yeah.
Basically.
I think for me personally, it makes me feel like things are a little more common than they are, because I'm only seeing sickness.
Yeah.
And so to me, sickness is really common. But in reality, it's not like there's hundreds of thousands of people in the world that are healthy. I'm only seeing the extremely sick people. But there's the flip side to that is like when you're only around healthy people, you think, oh, this is so rare. Nobody ever gets this. But in reality, there's, people in the hospital dying from it as we speak. So,
yeah, it's just a matter of living in our own bubble. And
exactly.
So, but thank you for coming on. I think this was good. I know we went long, guys. Thank you for talking for 2 hours. We didn't even.
And I feel like there's still like tons of things that I
there's
could say
so
and
many
talk about.
things like, oh man, we have generalities with treating infections when you need actual antibiotics or medicine, natural treatments when to go to the doctor. We kind of covered some of them. Personal stories, we didn't even get to that, where you decided to go the conventional route versus natural route. Well, you kind of said that with Anna and her sinus infection. But yeah, guys, there's a lot we didn't cover, but this is a very, very broad topic, and we could probably go on another 3 hours. So, and I love picking
That's
your
great.
brain, and I love hearing it from your perspective. So thank you very much for coming on.
Yeah, I'm glad that I was able to come and chat. Thanks for inviting me on. It was
Mhm.
good.
And guys, don't lynch us. Okay. This is also my platform where I offer my opinions and my thoughts and my ideas. And I might not 100% even line up with Holly on most of the stuff I did, honestly, just throwing that out there. But, um, she's able to share her thoughts and her opinions from her perspective. So don't just be so quick to just shut off someone and not listen because they have a different viewpoint than you do. Be open a little bit to kind of think about things differently. Don't get so wrapped up in everyone has to think the same way and do everything the same way. And, if you don't have a home birth, you're a sinner. Be careful making things into sins that are not sins,
Yeah. Yes.
So, any final thoughts? That is all I have.
I could say a lot, but I think we're
Yes.
done.
You could. We could go on and on, guys. So we'll just wrap it up for now. Hang on, Holly, while I end this. So we'll see you guys
Okay.
later. Have a
Bye,
great
everybody.
bye.